Hello friends, welcome back to my channel. Today we'll be talking about scapula. Scapula is a thin bone placed on the posterolateral aspect of the thoracic cage. The scapula has two surfaces, three borders, three angles and three processes. First we'll look at the surfaces. This is the costal surface or subscapular fossa and this is the dorsal surface. The costal surface, it is concave and it is directed medially and forwards. It has three ridges, three longitudinal ridges, and there's one more ridge which adjoins the lateral border, and this ridge, it acts as a lever for the action of serratus anterior muscle while doing overhead abduction. This is the dorsal surface of the scapula. It gives attachment to the spine of the scapula, and the spine divides the dorsal surface into the upper smaller part which is known as the supraspinous fossa and the lower larger part which is known as the infraspinous fossa. And laterally there is a notch at the root of the spine which is known as the spinoglenoid notch. Now borders. This is the superior border. It is thin and shorter. This is the acromion process of scapula. At the root of the acromion process, there is a notch which is known as the suprascapular notch. This is the lateral border. The lateral border is thick, and at the upper end, it presents a tubercle known as the infraglenoid tubercle. The medial border is thin and it extends from the superior angle to the inferior angle. Angles. There are three angles: the superior angle, inferior angle and lateral angle. The superior angle is covered by the trapezius muscle and the inferior angle is covered by the latissimus dorsi muscle. So when the arm is abducted, this angle it moves forward. The lateral angle, it is broad and it bears a cavity known as a glenoid cavity or fossa, and it is directed slightly forwards, laterally and upwards. Now about the processes. So this is the spine. The spine or the spinous process, it is a triangular plate of bone and it has three borders and two surfaces. So the borders include, this is the anterior border which is attached to the dorsal surface of the scapula, and the posterior border which is also known as the crest of the spine. It has upper lip and lower lip, and the lateral border which forms the spinoglenoid notch. And these are the two surfaces, the superior surface and inferior surface. The acromion, it has two borders and two surfaces: the medial border, the lateral border, superior surface and inferior surface, and there is the facet which attaches to the clavicle anteriorly. And this is the coracoid process which is directed forwards and slightly laterally. Now side determination of the scapula. There are three features through which you can determine the side. One is the glenoid cavity which is the broad and is directed laterally. And the second is the dorsal surface is convex and the costal surface is concave. So this concave surface, it fits on the convex chest wall. So the dorsal surface which is convex is divided by the spine of the scapula into the upper supraspinous fossa and the lower infraspinous fossa, and the third feature being the lateral border which is the thickest border. So through these features you can determine the side of the scapula. So now if you look at this, then we can say that this scapula belongs to the left side. Now let's talk about the muscle attachments. So the multipinnate subscapularis muscle arises from the medial 2/3 of the subscapular fossa. From the medial 2/3 of the supraspinous fossa, and from the upper surface of the spine arises the supraspinatus. And from the medial 2/3 of the infraspinous fossa arises the infraspinatus muscle. Deltoid arises from the lower border of the crest of the spine and also from the lateral border of the acromion. And the acromial fibers are the multipinnate fibers. Now the long head of the biceps brachiae arises from the supraglenoid tubercle here and also from the lateral part of the tip of the coracoid process. And the medial part of the tip of the coracoid process gives origin to the coracobrachialis muscle. The long head of the triceps arises from the infraglenoid tubercle, and the rough strip on the dorsal surface along the lateral border, the upper 2/3 part gives origin to the teres minor muscle, and the lower 1/3 part gives origin to the teres major muscle. The inferior belly of the omohyoid takes origin from the upper border along the suprascapular notch. Now muscle insertions. Serratus anterior is inserted on the costal surface along the medial border, and the trapezius is inserted on the upper border of the crest of the spine and also the medial border of the acromion. Pectoralis minor is inserted on the coracoid process superior surface and the medial border. Along the medial border on the dorsal surface, from the superior angle to the root of the spine, the levator scapulae is inserted here. And opposite to the root of the spine, rhomboides minor is inserted. Along the medial border on the dorsal surface, between the root of the spine of scapula and the inferior angle, the rhomboides major is inserted. Now about the ligaments. The margin of the glenoid cavity, it gives attachment to the glenoidal labrum and to the capsule of the shoulder joint. The margin of the facet on the medial aspect of the acromion gives attachment to the capsule of acromioclavicular joint. The coracoacromial ligament is attached from the lateral border of the coracoid process to the medial aspect of the acromion. The coracohumeral ligament is attached to the root of the coracoid process. The coracoclavicular ligament is attached to the coracoid process, the trapezoid part on the superior aspect and the conoid part near the root. This is the suprascapular notch. So the suprascapular ligament bridges the suprascapular notch and it forms it into a foramen through which passes the suprascapular nerve, and the suprascapular vessels, they pass above the ligament. Likewise, the spinoglenoid ligament bridges the spinoglenoid notch and it also forms it into a foramen through which passes the suprascapular nerve and vessels, which passes deep into it. Now about the clinical anatomy. This is the serratus anterior muscle. So the paralysis of this muscle causes winging of the scapula, in which the medial border of the scapula becomes prominent and the arm cannot be abducted more than 90 degrees. In a developmental anomaly called as a scaphoid scapula, the medial border is concave. If you have learned something through the video, please like and subscribe to my channel. Thank you for watching.